morning, everyone. And good morning, Queensland. Good morning from the beautiful Gold Coast. And it's wonderful to be down here today. And first of all, we want to talk to you about being safe in the surf over the Christmas and school holidays. So I'm very pleased to be joined here with David from Surf Lifesaving Queensland. And we've got a $150,000 donation going to the Surf Lifesaving across Queensland. We think they do a mighty job, and of course we want to minimise any tragedies over this Christmas holiday season, and we want to make sure that Queenslanders and visitors to our great state are swimming between the flags. So of course I know sometimes it seems very easy just to go and swim outside, but we want to see people swimming between the flags because the lifesavers can see you if you are between the flags, so it's an added safety. So on Christmas Day there'll be 92 beaches across Queensland which will be open, and 560 volunteers will be there helping on Christmas Day, so we're very happy about that. And of course we don't want to see drownings, and already I think we've seen already 3 tragedies this season. We don't want to see any of that happen over the Christmas New Year period and into the school holidays. So please, everybody, swim between the flags. And on top of that, our government has also given Surf Lifesaving Queensland $30 million over 4 years. I know this goes to much needed equipment. And of course, it's going to be wonderful to meet all of our beautiful little nippers that are here today, wearing their beautiful little hats and everything, and they are going to be the future. So thank you for everyone that's involved in this movement, and I'll let David say a few words. Thanks, David.
Good morning, everyone, and thank you, Premier, once again. Very humbled to be here off the back of last year's $30 million announcement by Queensland Government. This money goes directly, all of it goes directly towards vital equipment to help save lives. We've got rescue tubes, rescue boards, IRBs, communications and the like, and of course we are the only state in Australia where we don't charge our volunteers to become certified lifesavers, so a lot of this money goes towards training. And it gives more than that, it actually gives our acknowledgement by the Queensland Government and by our Premier, who is an amazing supporter of lifesaving. It gives great acknowledgement and great encouragement to our lifesavers. And just a few numbers, if you'll indulge me. We do have 58 surf lifesaving clubs. We have 34,000 members. In fact, when you consider the affiliate members of our lifesaving clubs, we have 378,000 people involved in lifesaving, nearly 9% of the Queensland population. On behalf of those people, I know they're all extremely grateful of this money that goes into volunteering. 10,000 active volunteer members that do volunteer and give up their time. They give up some 360,000 hours of volunteering time, and of course behind the scenes, behind the patrol, and we also have 3 to 4 times that with the tuck shop ladies, with all of the nipper helpers, the parents, the mums and dads, everyone who's involved in lifesaving. So the money goes directly towards those activities. Every year we save 2,700 to 3,000 lives. Since 1907 we've saved 150,000 lives, but as the Premier said, this season already we've had 3 tragic and very preventable drownings. And can I just say that we're overrepresented in young males. So that's been a long-term statistic for us on the Gold Coast, outside of patrolled hours, at night time typically, taking risks that they shouldn't take. So please tell your mates, you know, she'll be right, won't save your life. We need to get that message out to our young males. Please come and swim between the flags. And if you are a mate of someone that's looking to go for a nighttime swim, perhaps talk them out of that and get them to come down during the day. These are absolutely tragic. On Monday this week, we had Chris Casadas, the young jockey who lost his life in Surfers Paradise, his funeral. There are more than 600 people there. I know that our lifesavers who were engaged in that 48-hour search, they're deeply affected by this. Queensland Water Police, we thank them for their amazing assistance when they stood up with us. And we had a beautiful message from that department on the help. These are real people, these are real lives lost. And it does have an impact on our volunteers. They're not robots, they're humans, and we're just simply here to get the message out. we couldn't do what we do without the amazing support of Queensland Government and our Premier. She is a Premier of action. Last year she gave us record funding of $30 million over 4 years. She also gave us $6 million in infrastructure to help with maintenance issues on our clubs that sit right on the coastline. These create real jobs, and again, but they give hope and encouragement for our volunteers. On behalf of my board, on behalf of our council and our senior management team, we thank the government for their continued support. We're truly grateful, truly humbled. And please have a Merry Christmas and swim between the flags. We really encourage you to do that and look after your mates. Thank you.
Any questions for David at all? No? All right. I think we might get the Chief Health Officer, and thank you, David. We'll move on to some COVID-related matters. Okay, so first of all, can I thank Queenslanders for masking up? This is really important. It was a recommendation out of AHPPC, and already you've seen some states move on this. It was great to speak to some hospitality staff yesterday, and they said to me that they don't mind having to wear a mask if it means that they can continue to operate over Christmas and New Year period. So it's going to be really important that with Omicron now out in our community, and as we enter the next phase of this pandemic, people need to think very carefully about when they're going into indoor settings to wear a mask, unless you are eating or drinking. I want everyone to stay safe over the Christmas and New Year period, but we will see an escalation of cases like we are seeing in other states. But the good news is that at the present time, there's only one person in hospital, and they have other medical issues, even though they do have COVID. But that is the only person who is in hospital at the moment. We have no one else in hospital who is sick with COVID. So today we have 369 new cases. These cases are going to escalate, and this virus is across Queensland. It is now in the Banana Shire, Brisbane, Bundaberg, Cairns, Central Queensland, Gold Coast, Gympie, Ipswich, Logan, Maranoa, Mareeba, Moreton Bay, Noosa, Redland, Southern Downs, Sunshine Coast, Toowoomba, Townsville and the Whitsundays. So we all have a responsibility now to make sure that we are wearing the mask. When you're outdoors, like we are here, it's fine. But when you are going indoors, please mask up to help prevent the spread of Omicron. Yesterday, Queensland Health did 13,108 vaccines and 33,761 tests in the last 24 hours. And in terms of vaccine coverage, we're now at 90.1%, at least one dose, and 85.36% are fully vaccinated. And in terms of boosters, thank you Queenslanders for going out now and getting your third dose. I had mine the other day, no problems whatsoever. We now have 121,455 Queenslanders that have received that booster. But when you are due, it is really important. I was speaking to a group of people last night too who were asking about when they can get their boosters. When you become eligible, please go and get that booster shot. We had a very good National Cabinet meeting yesterday in relation to how important the boosters are for added protection, but also too in mid-January we need to make sure that we get the children vaccinated in time to go back into the school year. So there are going to be a lot of people working in January to make sure that we increase the coverage of vaccines. So if you are unvaccinated, can I say now is the time to get vaccinated. The evidence is if you are unvaccinated, you could end up very, very sick in hospital. So please think carefully about that. And finally, can I just say we're on the beautiful Gold Coast, but I am still worried that the vaccine coverage is not high enough here on the Gold Coast, which is one of the reasons we're doing this press conference here today. Across the southeast of our state, essentially every area is above 90%, except the Gold Coast region. Even Logan, Ipswich, where we had a huge vaccine drive, they have now hit over 90%. In Brisbane, they're heading towards 95%. But on the Gold Coast, it's 88.8%. This is a tourism hotspot. This is where the tourists are coming from just across the border. If you have not been vaccinated, go and see your GP or your pharmacist or one of our vaccination centres today. It is absolutely imperative that we drive up the vaccination rates on the Gold Coast. And yesterday I gave a big shout out to Mackay, 94.2% first dose. Well done, Mackay, that is excellent. And Cairns is over 90% now, they're at 91.7%. I really need the Gold Coast to come out and step up, and if you have not got vaccinated, to get vaccinated, or we are going to see people ending up in the Gold Coast University Hospital who are unvaccinated. This virus is here, it is right through our community. We are living with this virus. This is the next stage of the pandemic. Everyone wants to get on with their lives, but we are going to see a big impact on those who are unvaccinated. So I might leave it there and hand over to the Chief Health Officer, and then we're happy to take some questions.
Thank you, Premier. So today in Queensland we have 369 new cases to report. This brings the Queensland total to 2,977 cases since the beginning of the pandemic, and 807 cases are currently active. We have just the one patient in hospital with symptoms related to COVID, admitted for that purpose. This is a patient that I've mentioned before who has other medical problems, and I just will emphasise there are other patients in hospital with COVID, but there's just the one who are there for other reasons. But this is the one patient in hospital who's there because of the infection. I think it is important at times like this, as the numbers increase, that we reflect on what exactly we are trying to do and where we are going. The spread of this virus, which is now this particular strain Omicron, is extremely contagious. Not only is the spread of this virus inevitable, it is necessary. In order for us to go from the pandemic phase to an endemic phase, the virus has to be widespread. We all have to have immunity. You will all have to develop immunity, and there's two ways you can do that: by being vaccinated or getting infected. There are only two choices. There are only two ways to do that. And once we've done that, once the virus is spreading, once we all have some degree of immunity, the virus becomes endemic. And that is what is going to happen. The two interesting things: this virus is much more contagious than the previous strains, and that has been something of a surprise. But the early information we're getting is it seems to be a little milder, and certainly the vaccine is protective. So we are quite struck by, I think since we opened the borders just last Monday, on the Monday the 13th of December, we have had over 800 cases of COVID-19, but we've just got the one patient who has other medical problems in hospital, and the other patients that are there for other reasons, social reasons, etc. So yesterday there were 33,761 tests completed, and I thank absolutely everyone who came out to be tested. It's very important that we get tested to help protect the community. And again, if I could just go back to the philosophy of why we are doing what we are doing with the masks and with the social measures, it's just to try and slow this down a little bit. We're not going to stop it. We're going to just try and slow it down a little bit to enable people to get those third doses. So we don't expect to stop it. There are nearly 350 locations across Queensland where you can get a COVID-19 test. This includes both public and private providers, and as always we encourage you to look at the website to look for our testing locations. Queensland Health administered 13,108 vaccinations yesterday, and more than half of these were third doses. 85.36% of Queenslanders are fully vaccinated, and 90.1% have received one dose. We've now we've actually tested 123 confirmed Omicron viruses, but there's a lag in our testing before we actually know how many of that total 800 odd Omicron. It is very clear that Omicron is becoming dominant and will dominate henceforth. we've continued to see infections across the state. So wherever you live, you need to assume that you will be exposed in the coming weeks to this virus. So this includes Banana Shire, Brisbane, Bundaberg, Cairns, Central Queensland, Gold Coast, Gympie, Ipswich, Logan, Maranoa, Mareeba, Moreton Bay, Noosa, Redland, Southern Downs, Sunshine Coast, Toowoomba, Townsville and Whitsunday. And then all of these locations are published on the website. There are 163 people actually in hospital at the moment who have COVID, but they're not in hospital because they are sick with COVID. There are other reasons why they are there. A lot of them have to do with isolation and quarantine, and as we'll be learning more in the coming days of what we're doing to get these people out of hospital somewhere where they don't need to occupy a hospital bed. Okay, I think I might. Sorry, I made an error there. I'm sorry. I'm going to correct the figure. There are 163 cases who are being managed in their home at the moment. I'm sorry, that's incorrect. 163 cases being managed in their home and 93 people in hospital. 93 people in hospital, but only one of those is in hospital because they are sick with the virus.
Doctor, how many I guess staff ICU beds does Queensland have, and how many are being utilised now?
I don't have those figures here, but we had just the one single patient in the intensive care unit. They are not on a ventilator. I've spoken with the doctors. This patient probably won't be in intensive care for much longer.
Do we have a rough figure of, I guess, how many the state can actually hold in terms of ICU?
I don't have those numbers here, I'm sorry.
Do you think the booster timeline should be brought forward from 5 months?
That will be a decision for a TARGI. That's not a decision that I would enter into. There is an expert group that's been looking at this in great detail, and I think we'll wait for their advice. I don't want to grant that.
And just in regards to the booster shots, at the moment we're saying that if you've got 2 doses, you're fully vaccinated, but we know we need a booster to keep our immunity up. Will there be discussions around possibly changing the definition of what fully vaccinated is?
Those discussions about the definition of being fully vaccinated will occur sometime in the future.
Do you know when that will be?
Not immediately.
Are we still on track to bring down the border barriers and that kind of thing from 90%, or will that change?
Yes. None of those plans have changed. None of our plans are changing. The roadmap is clear. We are moving forward. We are not moving backward.
Yesterday, the Sunshine Coast, the police ran out of vaccines. The cracks beginning to show.
Sorry, could you repeat?
We've received reports that vaccine hub the Sunshine Coast has run out of vaccines and turning people away.
I don't think that's a government hub. I don't believe so. But my reports from our group are that there's plenty of vaccine in our government hubs. That might be a private facility.
Premier, just in regards to, I guess, testing lines, yesterday you said it was 10% were, I guess, interstate
Yes.
looking to come back. The Prime Minister said 25%.
No, 25% of people are travelling across the nation. 10% of that are coming to Queensland.
Is there an issue, I guess, in terms of testing line numbers? We've seen them.
We had a great National Cabinet meeting yesterday. We're talking about those rapid tests. We need to see how they would be administered. We're looking at bringing those in on the 1st of January. We've got another National Cabinet meeting in a couple of weeks' time where some of those issues you were raising previously will be discussed.
I guess some experts have said...
They're mandating booster shots for certain workers. Are you considering that for Queensland?
We will look at that, but I think at the moment we're encouraging people to go and get that booster shot. It's that added protection for you. It doesn't take much time. Just go and get that booster shot when it comes time.
Given the enormous lines that we're seeing at the testing clinics, why won't you advance consideration of the rapid antigen test used before January 1? This is obviously one of the most important weeks on the Gold Coast visitation. Tourism loss has expressed fear that the images of these huge queues are killing travel confidence.
My response is we have always kept Queenslanders safe, and the measures in place were the measures that were outlined in the roadmap, and the roadmap stands. Also too, I'm concerned on the Gold Coast that we do not have the high rates of vaccination that are needed in a tourist destination. So to your point, there are thousands of people coming here from New South Wales and from Victoria where the virus is rampant. They're coming here to the Gold Coast. and the Gold Coast is exposed because people are not vaccinated.
What do you make of a number of groups on social media where locals around the Gold Coast are sort of sharing what businesses are accepting people who aren't vaccinated?
Well, can I just say to everyone, this is about keeping the community safe. And like the Chief Health Officer said, we need that booster for that added layer of protection. And especially there are a lot of vulnerable people out there. At the moment, this virus circulates in young people. We are yet to see the impact that this virus will have on elderly people. So it's really important we get those booster shots, and for anyone out there who's unvaccinated is going to be exposed because this virus is out there.
Given that the testing lines are so long, why was the Dreamworld Parkway and Outback Spectacular testing sites closed?
We're not aware of that.
The January 1st date for rapid antigen testing, is that an arbitrary date? I mean, where's that date coming from?
We're getting some further advice about how they can be administered and how you'd be able to get confirmation. So we're looking at a range of measures. In other parts of the world, people can get their rapid antigen testing done at airports. When I went to Tokyo, you actually got your testing done there and then. You waited 15 minutes and you were free to go. I mean, there's a whole range of things here, and perhaps the airports could help us as well.
So if that data's already out there, you've done it, why not implement it?
No, we're not implementing it. It's not in the plan, okay? So we are keeping Queenslanders safe. This is about making sure that people get their boosters. And at the moment, we have something like nearly 300,000 people from New South Wales, Victoria and the ACT coming into Queensland. So it's increasing about 30,000 a day.
Some have expressed concern about the testing delays across the country due to, I guess, the requirements we had to re-enter Queensland, and I guess some experts
It's not
say
just
that
Queensland. Let's be very clear here. People are travelling all around the nation, and people are travelling from Queensland going to Tasmania. They require a PCR test. People from here going to South Australia need a PCR test. People travelling everywhere else need a PCR test. So let's be very clear about this. It's a bit Sydney-sided at the moment. So we want to keep Queenslanders safe. Everyone knows our roadmap. Everyone's seen that roadmap. And I'm asking people to please adhere to that roadmap. And also too, we're asking people to do the right thing when they're here as well. And that is about masking up.
I guess is the concern there with people who actually have symptoms that need to get tested may not actually be able to get tested because of the large numbers getting tested just for it?
There's about 90% of the lines in Sydney are for people getting tested because they're worried about having COVID. 90%.
With regards to staff isolating for 7 days if there's a positive COVID case that comes in,
They're national guidelines.
surely that's not sustainable in the long term.
They're national guidelines, and they'll have to get advice from AHPPC. So like I said, the Prime Minister said that National Cabinet's meeting in 2 weeks' time. Let's see what National Cabinet says.
Hospitality businesses are telling us this morning that they doubt they'll make it to New Year, given that too many of their staff are being forced to quarantine, and they say the state government seems unaware of how dire the situation
No,
is.
we absolutely are aware that this is a critical juncture, which is why we are mandating masks in hospitality. This is an added measure to keep our businesses open.
Will you consider compensation packages for some of these
No,
businesses?
no, we are in a pandemic just like everybody else is around the world. This is nothing new. In other parts of the country, in the world, businesses are shut. Some businesses have been shut for over a year. So, we're up to a tourist season at the moment, and we want to see businesses operating and people out there enjoying the Queensland lifestyle, but we are in a pandemic. So let's be very clear here. We are moving to that next phase, but these are national guidelines. They're not just state guidelines. These are national guidelines designed to keep the public safe.
So thanks everyone. We're going to
Last two.
There are multiple exposure sites at hospitals and health workers are calling for urgent meetings with the government to talk about the COVID response to the meetings.
The health minister's meeting with them. She meets with them regularly.
Premier,
And
just
last
one-
question.
Yeah, just on, I guess, with some businesses say that some work conditions are unsafe, wearing masks in heated areas or areas where there are foreigners. Is there some leeway
People have worn masks before. Queenslanders have done a great job, and it would be great to see if it was happening across the country. Okay, thanks everyone. Have a nice day.
Just going to get some pictures downstairs out on the beach.
Yeah.
If you want to come down and take photos down.